Listen, if there's ever a medical emergency, you probably know the first thing you should do. What is it? You call 911, okay? But what if you're having, or somebody you know is having a mental health emergency? What do you call, right? Do you know? There's a national suicide prevention lifeline. We've told you about it many times here on this show. I bet you can't tell me the number right now. That's going to get a lot easier starting Saturday, because instead of dialing like a 10-digit number, all you have to do is call 988. 988. That's the 911 for mental health emergencies, 988. But even though the switch to 988 is happening in something like 48 hours from now, there are some concerns that some states will not be ready for that big transition. Here's our Ron Allen with the latest.
Have you heard the news about 988? Don't worry, I got you. 988 is a game changer for those who are in crisis.
It's taken years to make it happen. Starting Saturday, 988 will become the new suicide prevention telephone lifeline across the country, replacing the longer 10-digit 800 number. According to the Centers for Disease Control, in 2020, about 20% of Americans age 18 or older face some kind of mental health illness. That's 1 in 5 adults, a figure growing even before the COVID pandemic made the problem worse, according to the World Health Organization.
I truly believe that shame is at the core of mental health struggle.
Kyle Freeman has experienced the crisis from numerous perspectives. Her brother took his own life. She admits she's contemplated suicide as well, and is glad the issue is being talked about openly.
When my brother died, I made a decision that I wouldn't be silenced by his suicide. And so I speak up to save my own life. I speak up on behalf of other people who are scared because of shame to speak up.
She's called the Suicide Prevention Lifeline, taken calls trying to help those in need, and says 988 is long overdue.
I think just the mere existence of it as a mental health crisis helpline is going to do a lot, because it's saying we're making mental health as important as 911 emergencies. It's just going to normalize mental health support. You don't feel shame for calling 911. You shouldn't feel shame for calling 988.
Someone dies from suicide in the U.S. about every 11 minutes. It's the second leading cause of death for people aged 10 to 14 and 25 to 34.
Do you really think 988 is going to make a difference?
Yes, I really do.
Kathy Marchi of Samaritans hopes and expects more people will call the new 988 Lifeline before their situation becomes extremely dire.
I think that coming out of the pandemic, and one of the great silver linings is that we are all acknowledging the mental health challenges that we experience, the loneliness, the lack of being able to do the things that bring us stability or comfort.
But is America ready for 988? The Lifeline is a patchwork of around 200 local, independently owned and operated crisis centers.
I'll just kind of check up on you and see how you're doing.
Many run by nonprofits, staffed by volunteers, and straining to answer calls as quickly as they'd like to. A federal law created 988, but left each state to figure out how to fund it. A recent report said more than half of public health officials tasked with launching 988 said they needed more resources.
And some states are more ready than others. When people dial now the 3-digit number, you're linked typically to the nearest center to you. However, if that call is not being able to be answered because that center is not properly resourced, it can roll over to a national backup center that no matter what happens when people call, they're going to get an answer if they can just hold on.
What do you say to people who might be watching or hearing this and are thinking about calling but can't quite get themselves to do it?
Call us, because you will be greeted by a person who is there to help you, a caring, non-judgmental ear in your time of need.
Ron Allen is joining us now live. Ron, I'm so glad that you are shining a light on this story. I thought it was incredibly powerful to hear one of those women say, you don't feel ashamed for calling 911. You shouldn't feel ashamed for calling 988, right? Because I think that speaks so much to why this is important. But do enough people know about this? How is the government? How are people getting the word out that starting Saturday, like really soon, this number is going to get fired up nationally?
They're doing interviews, as we have been doing with them. They're talking to a lot of media. They're getting out a lot of information on social media, targeting advocacy groups and mental health professionals. It's a very targeted campaign, and it's going to get more broad. It's going to widen as the months go on, and there's a bigger campaign planned for next year. I think they're kind of gearing this up slowly because the system as it exists now is under a lot of pressure. There's about 2.5 million calls a day to the Lifeline, and by the way, even when this 988 number goes into effect, the 800 number that's current will still work. You can use either one. But there's 2.5 million calls a day, and they think that because of the publicity surrounding this and the attention at it, those number of calls could double or even triple. And so there's a lot of concern about the stress on the system. But they still want you to call, as you heard.
Right.
If you can't get through to your local line, you will get an answer. They answer every call they possibly can. And the call is just the first step. The call is the beginning. What they want to do is then send people into local communities where they can get help and resources. The vision is to have mobile units that can go out and respond and meet people where they are to help who call in first. It's to have in communities certain facilities set aside for mental health crises, like there are ER rooms now for other kinds of medical emergencies. So this is a big step. The country's ready for it, people say. It seems like a really good idea that time is overdue, but they're getting into it slowly, and hopefully it'll work and save a lot of lives.
That's the hope. Ron Allen, I'm so grateful to you for bringing that to us. Thank you. As you heard Ron report, 988 goes into effect everywhere on Saturday, but in the interim, if you or somebody that you know is struggling, this is the number that's active now, 1-800-273-TALK. There for you as a resource, again, becomes 988 in just 2 days from now everywhere.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.